Americans don't even get affordable health care right now. What the fuck makes you think immigrants do? They're not trying to take away health care for immigrants, they're trying to take away health care for you.
Thousands of families here in Florida's 21st District rely on the Affordable Care Act subsidies to afford health insurance. But these subsidies are set to expire at the end of the year, and it's going to hit working families extremely hard. With subsidies gone, premiums can jump anywhere from $800 to $1,200 per person per year, leaving families forced to choose between groceries, rent, or their health care. Seniors and small business owners will feel the pinch first. As a firefighter and paramedic here in my community, I've seen the consequences when people delay care because it's too expensive. This isn't just numbers for me, it's real lives and real families.
Imagine an older couple out there who's making $85,000 a year. That's not billionaires or anything like that, but that's a higher earner in this case. Here's their current premium, $7,225 per year. That's 8.5% of their income. That's sort of the top end under the current rules. Under the change, if it expires, that will jump to $25,000 per year. That's almost a 30% increase. That's almost 30% of their income, not an income, 30% of their income for the year. That's a tough thing if you're making $85,000 a year.
The government shutdown was just a couple of days ago, but yesterday, October 2nd, I got this letter talking about how my monthly premiums are going to go up for my health insurance. They obviously sent this out before the shutdown even took place in order for me to get it yesterday. So look at this. 2025 monthly payment is $218. They broke it down for me though. Thank you. Here's the math. Monthly premium of $627 minus $409 of financial help you get each month. That's the Affordable Care Act going away. So $627 is right now. Starting in January, it's going to be $727. So not only did they take away the $409, they increased this by $100 a month. What the
They are absolutely correct, you guys. And right here is a little side-by-side comparison because, MAGA, they love to look at charts and they need some sort of picture so that they can really understand things. So this is with the Affordable Cares Act. This is without the Affordable Cares Act. And this is what the Democratic Party was trying to stop before this whole government shutdown because the Republican Party wants to remove the Affordable Cares Act. That's what they want to do. It's not about undocumented migrants getting health care. It is not about that. It is about the lower class and middle class citizens here in the United States of America that can afford health insurance, plain and simple. And here's the other thing, you guys. The job market, the economy, since Donald Trump has taken office, it is the worst economy since peak COVID time. The worst economy. The job market, non-existent. Every single month when they end up releasing the jobs report, guess what? They're not adding new jobs. They're taking away jobs here in America. That is what they are doing. And for those that aren't from America, you guys have to understand this also. A simple hospital visit for someone, if they don't have health insurance, let's say they go to the hospital, they have to go to the emergency room and they're sick and they need urgent care right then and there. A simple visit can literally cost the American person thousands, if not tens of thousands, just going to the hospital. And I know you're thinking, well, just don't pay the bill. Well, here in America, guess what? If you have a job, they will garnish your wages. So now you're making even less money on your paycheck because you ended up having an emergency visit to the hospital. Also, here in America, if you don't have health insurance, and let's say you get taken by an ambulance and everything, let's say you need an ambulance and you call, you're like, yo, I need someone, that right there could be tens of thousands of dollars as well. Let me know your thoughts in your comments over this way, because that is what the Democratic Party is trying to stop with this whole government shutdown.
Guys, this is actually week 2 or week 3. I've even lost count because this government shutdown has been going on for the longest, and I don't think I've experienced something like this. The last time this happened was actually like 7 years ago, where there was a similar government shutdown, but this time round the representatives are asking for changes in the healthcare. We're talking about the ACA, Medicaid, Medicare. People are angry. Some are anticipating to see healthcare exploding in terms of costs. Obviously what they're paying right now is going to skyrocket because because of the ending subsidies of the ACA that's ending at the end of the year 2025, that was put in place during the COVID period. The Trump administration has no plans to renew that. Look, the enrollment starts in November 1st, and people are skeptical to even sign up because they don't know what's going to happen. And this is what exactly the representatives are pushing for. They want reforms, they want changes. At least a subsidy should be offered for the people in order for them to enjoy the benefits of the ACA. Right now, it's about 42 million Americans that are really dependent on the ACA. And if that remains unsubsidized, there's a threat of losing over 4 million users, of which each and every American needs healthcare. If these people are going to be cut out by this system, then how are Americans going to have better health if they cannot afford basic health? But guys, there's a lot to unpack in this video, and I'm gonna urge you to sit back. Let's continue listening to more opinions, and then thereafter we're gonna do a breakdown of all this and just try to understand what's happening in the healthcare field. Let's go.
I pulled a Republican aside on the floor and I said, hey man, there's no cameras around here. I just want to understand. Like, I'm not here to put you on blast in front of a camera, just person to person. I genuinely want to understand, because people think that trying to understand another person means that you agree with them or that you're being soft on them. And it's a huge problem in this day and age, because that mentality really prevents people from being able to connect and persuade. But I pulled this guy aside and I said, hey man, like, I know that you represent a couple of rural hospitals, and this bill is going to devastate rural hospitals. I just want to know from your perspective, are you worried about that? What are you thinking about with your hospitals and your people? Because a lot of people don't know, like a ton of ACA recipients are in red states. A lot of Medicaid recipients are in red states. These are like Trump voters that are almost disproportionately, in many circumstances, being negatively affected. And so I said, like, walk me through how you see this. And he was like, yeah, I just don't believe it. He's like, I know that you guys need to make a big deal out of this to like score political points, but I just don't believe it. And I'm kind of sitting here like, this data shows that this bill is going to devastate a lot of people. But a lot of these folks just like don't believe that data. You know, there was one hospital in one of these districts. I was like, yeah, we might have to close. And they are now on their back foot. Like, they thought this was just a Democratic talking point. And now that their own people are being affected and their own hospitals are warning them, they are now kind of low-key panicking.
It is an undisputed fact. In fiscal year 2024, Medicaid costs for emergency services for illegal immigrants skyrocketed by 142% from the previous year to $9.1 billion.
All right, let's do this again. Fact-checking claims on how much we spend for emergency room care for undocumented immigrants every single year. And Caroline Levitt just claimed that number was $9 billion. And she said that was undisputed. Now, is that true? We'll get to that in just a second. Because even if it were, that $9 billion is far less than the $20 billion line of credit that the president has offered to Argentina that has been very unpopular with his supporters. And it's also less than the cost of a single Gerald R. Ford class aircraft carrier. Those are $13 billion to build. But here's the thing with that $9 billion claim that Levitt made. It's not backed up by any public numbers, not from the Congressional Budget Office, not from the Government Accounting Office. Instead, according to the numbers that the public does have from the government, that total is closer to about $3.8 billion. And that makes up just a sliver of overall Medicaid spending, 0.4%, this tiny amount versus the rest of the money we spend on everything else when it comes to Medicaid. And a reminder, those immigrants aren't eligible for Medicaid except in kind of a roundabout way in those emergency situations. And they use less health care and have lower costs each year than people born here in the U.S. This is according to congressional research. So when it comes to the press secretary, she's got the benefit that it's hard to fact check her because typically hospitals don't actually track immigration status when they provide that emergency care. And again, this is all thanks to Ronald Reagan when he signed the Emergency Medical Treatment and Labor Act into law back in 1985, which requires hospitals to provide care to anybody in need, regardless of their ability to pay or their immigration status. And that same year, Reagan signed the Immigration Reform and Control Act of 1986, which gave amnesty and legal status to about 3 million immigrants. And when he signed it, he said it improved the lives of people hiding in the shadows who didn't have the benefits of a free and open society.
Our objective is only to establish a reasonable, fair, orderly, and secure system of immigration into this country and not to discriminate in any way against particular nations or people.
Back to Levitt and those numbers. Even if they were accurate, let's put them into perspective. So undocumented immigrants pay about $100 billion a year in federal, state, and local taxes, and more than a third of those dollars go to payroll taxes that fund programs that these workers can't access, and that includes Social Security, unemployment benefits, and Medicare, $6.5 billion worth. In fact, without those undocumented immigrants contributing to these programs, some estimates say they'd go bankrupt. So before we start blaming undocumented workers for breaking the system, maybe we should recognize that they might be one of the reasons that the system is still standing.
So after listening to several speakers, you guys notice that there is a pattern here, and shout out to AOC if she actually did a sit down with the Republican and listen to opinions they have and see what they think, how they think, and what exactly they want in this situation. But hey guys, this government shutdown is not just a political theatrics or political theater. It's a healthcare cliff. Well, for progressives, they feel like if this is going to happen when SCA subsidies are no longer renewed and Medicaid cuts proceeds, then it's going to be a hazard, especially to the health of the elderly, the poor, the disabled, even kids. The progressives are betting that if they stand firm right now, this coverage is gonna be protected long term or into the future. But according to Trump and his administration and his entourage, having austerity measures right now and deregulation also to them is how they think they are gonna reshape this system. It's one of those gridlocks that if you are an independent or a moderate, it actually sucks because you don't know when this gridlock is gonna end and the government just continues to work. Because when the government doesn't work, how is the country supposed to run? According to Democrats, they feel like there is no way the country can continue forward when healthcare is being taken for granted, or when the changes that the government is promising to make is going to affect millions of Americans. While according to Republicans or conservatives, they feel like the Democrats are holding the government hostage when they are not letting them to proceed with the measures that they want to, which according to them is going to be helpful to the Americans in the long run. They feel like the healthcare welfare that progressives are pushing for are the ones that exactly helps undocumented migrants who want to benefit or who are going to benefit from these healthcare services, and they feel like it's Americans that are going to benefit if the system is reshaped. But hey guys, we're going to look at what Trump is proposing. I'm gonna read it out. I think most of it we've heard from different speakers. So according to him, permanent Medicaid needs to be restructured. This needs to a shift in control to states, which will add work requirements and cutting federal contributions. Number two is the extension of SCA subsidies, which he argues that they are unsustainable and it's reward dependency. Well, according to him is that when Medicaid is subsidized, I don't know how long the government is able to hold this subsidy, and also providing subsidy to people is not an incentive to people working hard in order to afford this in future, and hence people are just relaxed knowing that after all the government has our back. That's how the administration says. Number three is the federal job cuts, where it includes health agency staffs, which could cripple oversight and public health response. And the last one is it targets spending. It prioritizes defense and border security over health and social program. It's no lie that Donald Trump has been big on borders, of which I appreciate him for doing that. The borders are now secure, things are running, but if things are running there and the borders are secure, why not now allocate these resources or the spare resources to things like health and social programs, which will impact the social life of Americans or their day-to-day? Where you see right now, of course, people are complaining about how the cost of living is so high, and it gets even worse when we bring healthcare in there because it's exploding. If you look at the trend, this healthcare is going to skyrocket and people are no longer going to afford. Look at the premiums for health insurance right now. They need Insurance, if they don't have insurance, we all know how the American hospitals overcharge the citizens or the people, and it's almost impossible to afford it. And if people do not have this, then how are they going to survive? There's something that people need to look at. The morbidity in the population right now is very high. People are susceptible to diseases right now. So many people are not eating healthy. Look at the way groceries are rising. People have no jobs. People have been laid off. If someone cannot afford eating healthy, not just eating but eating healthy, all this contribute to high rates of morbidity. And if the government does not look at how the morbidity is rising, then there's going to be a health crisis in the long run. When there's a health crisis in the long run, people cannot afford this basic medical attention, then definitely from morbidity now we go to mortality rates. And when mortality rates are higher, then it's gonna be a problem for the whole country. No, that's just about it. I don't know how it's gonna run, this government shutdown thing. I'm just curious, how is it gonna end? And it's one of those stories that I promised to bring it from the start to the very end, and this is just an update. I think my next video will be people's opinions or how they think. Do they want this government shutdown to end, or do they want them to hold a little bit longer so that the government can listen to people's grievances? Well, that's just about my opinion today and other people's opinion that you've listened. How about yours? It's at this point that I'm curious and really want to hear from you guys. Please don't be shy to share your thoughts and opinions in the comment section down there below. For the creators that are featured in these videos today, please go and check their TikTok accounts. Follow them, like their videos. For this specific video, make sure you smash a huge thumbs up button. Consider subscribing, turn on post notifications so that you may not miss my next upload. And with that guys, Danny here, signing out. Peace.